I don't think this was a surprise. In general, we see a surge in the ultra-Orthodox community. Like in previous waves, we had people returning from abroad, and then the general population had its share, and then it was moved to other more densely populated housing, like in the ultra-Orthodox and the Arab community. I think there was also a false assurance by the ultra-Orthodox that they got into herd immunity, and this is, of course, not true. We see, on the other hand, a very, very good engagement with the ultra-Orthodox in terms of rising rates of vaccination and testing. So I think that the ultra-Orthodox case can serve as a pilot. I totally support the opening of the school year on September 1st. I think we were unfortunately world record in closing schools. Public health is not just about counting corona cases. It's also about the psychological, mental health, and the development of children. And I think that the current program with the ministry, agreed by the Ministry of Health and Ministry of Education, is a nice way of doing risk management. So we can maybe have a rise in cases, but I think we had all the tools to see that is contained, not just vaccination, but also doing lots of work about testing, about reducing number of children in class when possible, and helping those places that needs help together with the civic society and municipalities.
So the schools are one place undergoing what appears to be a massive set of reform here in order to keep them open, keep children safe from the coronavirus. On the other side, the hospital reforms here. I believe some 7 hospitals today saying that they're overwhelmed, that they may have to turn away corona patients or other patients perhaps here now, and that they're not getting the government reforms that were promised in order to keep them open here. Is this a process that simply takes more time to implement, or is there a problem there?
This is an ongoing problem now for years. We're talking about hospitals that are not part of the government system and are not part of a health fund like Clalit services. These are hospitals like Hadassah, Shaarei Tzedek, that for years the country, in a way, Israel counted on, other organizations to support them. In recent years, there were discussions how to make things more standardized, especially to have them planning for years ahead and not just every year to be in deficit. There was an agreement that was signed that I think was fair, but the problem that was only partially implemented. And I think that, like many other things, COVID presented us a mirror about our healthcare system and how it is overwhelmed. And I really hope this will be solved very soon. The problem is unrelated to COVID, but of course very exacerbated because of COVID. There was an agreement that it must be implemented as soon as possible.
Want to get your thoughts on another thing while we have you, Dr. Davidovitch. The serological tests now beginning nationwide for children aged 3 to 12 here, the age group not yet eligible for the vaccine. Well, the data that comes out of that, is that gold for the nation's decision makers? Is that key? Will that really help going forward manage the situation better?
So this is a part of a larger program. We want to have these serological testing in order to understand better the situation and see, what is the share of those who are asymptomatic infection, probably much higher than we are aware. This is true in general in similar cases of viral, upper respiratory viral infections, but this is not enough. We need to have all the measures that I mentioned before, and especially working together with parents and teachers on every school with the local authorities to implement and see, because there are different demographies, different spaces, and use any innovation like teaching outside, and this must be decided on the local level. We have the tools, and we need to see education as something that is of utmost importance from a public health perspective.